Aloha and welcome back. We're doing Chapter 4 today, Skills and Interventions. All professionals use tools to accomplish their jobs. For example, a professional baseball player uses a bat and a ball and a mitt. An accountant would use a calculator. An airline pilot uses an airplane. What's unique about the human service field is that the professional, you are the tool. All tools in all professions need to be in good condition. A lumberjack needs to have a sharp saw. So in human services, you as the professional must be educated, trained, and refined. You must be very sharp. Before we go any further, we need to discuss the concept of informed consent and confidentiality. You will find this in your text on page 58. Please highlight it. Informed consent refers to disclosing to the clients the nature and risks of counseling before services begin. Not after, not in the middle, but before services begin. There's a commitment on the part of the counselor social worker to keep what is in counseling. What is confidential needs to stay confidential. Why is this confidentiality so important? It's a human psychology development reason. It is because it is based on the belief that for trust to develop in the counseling relationship, clients must be assured that they have a safe place to discuss their most private thoughts, fears, and experiences. This privacy is considered so vital to mental health treatment that it is mandated by law in all 50 states. There are limits to confidentiality. Human service professionals are bound by these two statements. Let me quote them from your book. Human service professionals protect the client's right to privacy and confidentiality, except when such confidentiality would cause harm to the client or to others, or when agency guidelines are previously stated and supersede some of those rules. 2, if it is suspected that danger or harm may occur to the client or others as a result of your client's behavior, you, the human service professional, acts in an appropriate and professional manner to protect the safety of those individuals. In other words, you have a duty to warn and to protect. For example, if you think a client may be suicidal or homicidal, you need to alert the proper authorities. Cultural competency and or cultural sensitivity, you could say, is another area we need to be very sensitive to, because it is the counselor's ability to work effectively with people of color and minority populations that will get you to get the job done. You must be sensitive to people's needs in different cultures, in all cultures. You must recognize the unique experiences of other cultures. Here's your question for the discussion. Remember, go to La Lima, to the discussion tab. And your question is, what is an authorization to release information document? When would you need to use one? The question and the answer are in your book. So, until Chapter 5, which is Child Welfare Services, let me just say aloha. Take care. Thank you.